Hello, and thank you so much for joining me to discuss this critically important topic for healthcare providers who care for our country's service members and veterans. There are tens of thousands of service dogs in service today. This is a subject that is close to my heart and close to my leg. Service dogs are a life-changing and often life-saving therapeutic intervention for people with challenges and play a special role in the rehabilitation and recovery of wounded military service members and veterans. My name is Dr. Bob Kaufman, and I'm a retired Navy psychiatrist and a combat veteran. I'm also what is known as a holistic psychiatrist, meaning while I still use established clinical-based guidelines and proven practices, I have studied and used therapeutically alternative forms of healing to include acupuncture, animals, and arts in my practice. I currently serve as the Senior Medical Advisor for Warrior Canine Connection, and perhaps most important to me, I am the proud owner of Ron, a trained service dog who, besides being a valuable part of my life today, is also my co-therapist and facility dog. I hope to share with you a little bit about the literature on why service dogs are so vital to the recovery of your veteran patients, offer you further understanding of valid clinical indications for placement, as well as give you information that may help you and your patients who desire or require the assistance of a service dog. By the end of this course, you should be able to define animal-assisted activities, animal-assisted therapy, emotional support animals, and service dogs. Discuss the human-animal bond and some of the health benefits of interacting with animals. Recognize situations that might make providers think about service dogs as a modality of treatment for wounded warriors. Understand specific steps providers can take to refer veteran patients to an accredited program for service dog placement. And understand the important role that providers can and should play in their patient partnership with a service dog. Let's get started. It might be helpful to begin with a few definitions that will help us throughout this course. As you are certainly aware, there are a number of ways to describe dogs used to help people, and it can be confusing for providers and patients alike. The Americans with Disabilities Act defines service dogs as dogs that are individually trained to do work or perform tasks for people with disabilities. Currently, the most recognized governing bodies are Assistance Dogs International and the International Guide Dog Federation. For veterans, a service dog can be obtained from an ADI-accredited service dog organization that is also recognized by the Department of Veterans Affairs. These dogs are trained to perform tasks for the benefit of an individual with a physical or mental disability and to respond to a verbal command or the condition of that person. While helpful, dogs in training or whose function it is to provide emotional support, comfort, therapy, or companionship are not recognized as service dogs. Service dogs perform a number of tasks for their veteran, including, but not limited to, assisting individuals who are blind or deaf, pulling wheelchairs, providing medication reminders, nightmare interruption, opening doors, picking up items, helping with activities of daily living, managing crowds, assisting individuals during seizures, and regulating emotional states. Much like medicine itself, certain tasks such as monitoring and sensing declining blood glucose levels or alerting to prodromal seizure activity are the domain of specialty trained service dogs. In the case of regulation of emotion, dogs are particularly suited to sensing human anxiety and buffering and diverting attention from anxiety-generating stimuli facing the veteran they work with. In addition to service dogs, you, as healthcare providers, might hear about a number of ways animals are used to help people thrive. Animal-assisted activity is used in a variety of settings to provide therapeutic, motivational, educational, and recreational benefits, and to enhance quality of life. One of the most famous facility dogs, Sully, has become a real rock star. Animal-assisted therapy, a goal-directed intervention in which an animal is integrated as a vital part of the treatment, is delivered with a trained professional. This modality can help improve self-esteem and help build or rebuild social, emotional, and cognitive skills. Importantly, animal-assisted therapy can also dramatically decrease anxiety. For example, mental health professionals sometimes use combat stress therapy dogs in combat zones. Army occupational therapists found that these dogs gave them an opening with their soldiers who sought care. Their patients talked more openly and for longer periods of time with dogs present and provided compassion in a clear and present manner. In contrast to service dogs, emotional support animals, or ESAs, are not specifically trained, don't involve professional facilitation, and their handlers do not have public access. Only users of appropriately trained service dogs are granted public access. The Americans with Disability Act guarantees an individual with a service dog will have free and unfettered public access, which means that service animals are allowed in restaurants, public transportation, and even hospitals. Public access can be denied if an animal is not properly trained or its behavior is disruptive and not representative of a reasonable accommodation. In those cases, the service animal user can be asked to remove the animal from the place of business and acquire additional training. Now that you understand the different ways animals are used to help humans, let's discuss why this bond is so important and what we know about how it impacts recovery, rehabilitation, and renewal. The human-animal bond has existed since recorded history. From an evolutionary perspective, it makes sense that paying attention to animal behavior was beneficial to human survival. Humans have always been attracted to the animal kingdom. Even young infants show more interest in animals than in other objects. Today, of course, culture and background play a role in how individual people respond to animals. Research shows us that people walking their dogs have more positive social interaction with others and are considered happier, friendlier, less threatening, and more relaxed than those without dogs. But this is a course for healthcare providers. Bottom line, the literature is clear. You may want to advise veterans in your care to interact with animals because it's good for their health. To be clear, pet ownership alone seems to be beneficial. Multiple studies have shown that owning a pet lowers blood pressure in response to stress, reduces risk for cardiovascular disease, and even increases one-year survival rates following heart attack. It has also been shown to significantly increase the number of daily steps taken. We think this is due to increased social support and exercise, perhaps through the need to take the dog for a walk, although there may be other contributing factors as well. More broadly, being around animals is good for your health. One study showed that simply watching animals at peace decreases arousal. Multiple additional studies show reduction in heart rate and blood pressure when in the presence of animals. Knowing this, it probably doesn't surprise you that animals have been integrated into rehabilitation, recovery, and therapy protocols for people in challenging medical and psychiatric situations. The research on animals in these roles, though in its infancy, have been overwhelmingly positive, and there is little question that animal-assisted interventions add measurable value in therapeutic outcomes for those with physical disabilities such as hearing or sight impairment, mobility challenges, or seizures. In addition, early evidence shows great promise for the role of dogs in mental health and cognitive realms. Like mobility service dogs, psychiatric service dogs are specifically trained to assist in the management of certain behavioral health conditions. In addition, substantial peer-reviewed evidence points to the significant impact of animals as part of therapy and outcomes for depression, PTSD, autism, dementia, even Alzheimer's disease. Some even theorize that these benefits might be based in what is known as face-heart connection, which allows face-to-face interactions between person and dog to dampen defensive systems and to promote mental health. Wild stuff, but consistent with neuroscience. Let's spend a few minutes talking about a very specific group of patients, veterans with invisible wounds. As providers who strive to provide outstanding health care for these warriors, you may see disproportionate numbers of veterans who suffer from what are called the invisible wounds of war, most notably PTSD and traumatic brain injury. Both of these challenges reduce neural and hormonal function in the prefrontal cortex and amygdala, which impacts memory, learning, emotional regulation, and empathy. In fact, veterans with mild TBI from blast exposure experience pituitary dysfunction at staggering rates, hundreds of times that of the general population. One of the pathways to this dysregulation is found in the pituitary neurohormone oxytocin. Oxytocin has been referred to as the love hormone because it is integral in social bonding, attachment, the development of prosocial behavior, and healing and relaxing. We see decreased levels of oxytocin in those veterans with mild TBI and PTSD. Consequently, cognitive, emotional, sleep-related, stress-related symptoms become distressing and therefore contribute to dysfunction. Fortunately, research shows increasing levels of oxytocin restores prefrontal and neural function in veterans with these hidden wounds and mitigates these symptoms by reducing the perception of pain, anxiety, and depression. Helps to promote sleep and enhances working memory. I think of animal-assisted therapy as oxytocin with a tail. This pair bonding facilitates social behaviors of trust, empathy, and optimism. Friendly social interaction with dogs can help people with PTSD increase oxytocin and regulate their distressing symptoms. I believe this increase in oxytocin acts to lessen the prevalence of PTSD triggers. Whereas service dogs directly promote socialization through an increase in oxytocin levels, indirectly, dogs bring about improved social engagement because it is near to impossible to isolate in the company of one of these beautiful retrievers. For instance, Warrior Canine Connection uses what they refer to as mission-based trauma recovery. It is mission-based in that it involves wounded warriors training dogs for other wounded warriors, trauma recovery in that it is not just placing wounded warriors with dogs, but addressing the trauma of PTSD by actually using the training of the dog as an active intervention. Training a young pup takes patience, affect regulation, and genuine empathy, skills which many wounded warriors must relearn. A number of longitudinal studies are currently underway with veteran patients who suffer from PTSD to assess the neurohormonal, cognitive, behavioral, and emotional benefits of training with service dogs in the Warrior Canine Connection program. Now that you understand the value that service dogs can bring to medical treatment, rehab, and recovery, you might be wondering about practical implications for your practice with military service members and veterans. Now let's discuss your veteran patients and some of the symptoms that might suggest that a service dog could provide additional benefit to your treatment plan. There are a number of psychiatric presentations that now also warrant your consideration. For years, anecdotal evidence has suggested that dogs could help reduce mental symptomatology. However, in recent years, controlled trials now provide solid evidence. That study showed that adding a psychiatric service dog to the usual care led to clinically meaningful reductions in PTSD and depression, and also improved quality of life and increased social functioning. Bottom line, trained psychiatric service dogs can make a difference, and they are not just for PTSD. In addition to the assistance they provide for patients with physical challenges and medical issues, consider service dogs for patients with neurovegetative symptoms of depression, anxiety attacks, and social isolation. Look for patients in which you see comorbidity of these symptoms and those of PTSD. I like to recommend considering a well-trained service dog for patients who suffer disabling agoraphobia. Not only will dog owners in general get out of the house more to walk their dogs, but one study showed that the odds of a dog owner meeting current physical activity guidelines increased by a factor of 4 when compared to non-dog owners.